All right, we are live. No technical difficulties tonight because we're not going remote like we tried last night. It's Karen Anderson here with Aortic Hope, and it is Aortic Disease Awareness Month. And this week, as a lot of you know, is our Emotional Mental Health Wellbeing Week. Hey, Tia. We have been talking a lot this week about what you go through with potential PTSD after an emergency situation like a dissection. We've been talking about the anxiety of waiting and watching your aneurysms. And so tonight, we were supposed to have this a couple nights ago, but tonight we are lucky to have Amy Wagner with us here again. She's done this with us a couple times, which is great. And we're going to be talking about all the different emotional things you're going to feel potentially when you are in that emergent situation, having had a dissection, or the whole watch and wait aneurysm anxiety, and then the general anxiety that just comes with having aortic disease and what's this ping and pang, what's that? In addition, we'll talk a little bit about, hey Jenny, hey Nicole, hey Bobby. We're going to talk a little bit about the guilt that you might feel, that you might be a burden towards your caregivers. Resentments that build up. If there's any caregivers that are out here, just let us know and we will we'll address that. Yes, today is, just so you know, actually it was originally Aortic Dissection Awareness Day, and then it changed to Aortic Disease Day. So today is the actual day, but we've been celebrating for the entire month. So we believe the month is a true celebration. So let's get started, and as people join, you'll have a chance to review this video in full. We're going to talk first, and then please go ahead and give us your questions if you have any. So that was a mouthful.
That was a lot. Very good.
I'm a patient. I've been coming here to see Amy. Now it's been a while, and we've done some EMDR therapy, which we'll get into. But so let's just talk about what happens to people when they have a disease, a physical ailment. What can this do to somebody's emotional and mental well-being, both just with an ailment and then with a traumatic event?
Well, I think when you first hear your diagnosis and get the news and all, there is that initial shock that you have to work through. But then I think you can enter into that whole mode of fear of life, death, that gets questioned. What does this all mean for me? It doesn't mean the end of my life. And a lot of times we allow our minds to go to that worst case scenario and forget that there may be so many other options in between there. But it is normal to have anxiety be stirred up to a much higher level than you normally do. But I think the more facts you can get and more information, that will help with keeping that anxiety down. It's the fear of the unknown, so making sure you ask a lot of questions at your doctor's visits and those sort of things. Sometimes I will suggest to clients not to go off and Google so much on their own, because that can be even more anxiety producing, because we tend to fit ourselves into all of those symptoms and it may not be what's going on at all. So the main thing is to just gather information, ask questions of your healthcare providers.
So let's start first with, because a lot of this will be applicable either way. So for a lot of people out there that have had a dissection, we're not even aware that we're having PTSD. We might start having nightmares, irritability, inability to sleep. There's a lot of depression that comes post-op with any surgery, let alone open heart surgery, and that's been studied. So what would be the signs that you are suffering from depression? What would be the signs that you might have some PTSD from your experience? What should people be looking out for?
Well, as far as the post-traumatic stress disorder, just number one, having flashbacks about the event that happened that led up to your dissection, having difficulty sleeping. And that can be related to your health condition, but that also is related to not being able to calm your mind down enough to sleep soundly. You may also be a little more irritable with your loved ones or friends. You may find that you withdraw more. You don't want to be around people. You may feel also like you might want to cry all the time. And those are all normal symptoms as well. you may also find that you might be obsessing over one part of the whole experience as well. So I can also give you a sheet that you might want to post or something like that for signs and symptoms to look for. But it's anything that takes you out of your normal way of that you had been living prior to the event happening. But the main thing is flashbacks, getting triggers. I know we've talked about triggers, things that might set you off, like smells or just hearing ambulances,
helicopters,
siren, any of that kind of thing, needles. It could be anything, things you might not even think of. Just seeing someone in scrubs walking into a restaurant or a convenience store might be like, okay, that reminded me of the hospital or something like that. So just realizing those are normal things. But after any event like this, I really think that even though you're taking care of your body, you need to take care of your head, your mind.
And one of the things for me, as soon as my dissection happened, the first week I came home. So I was seeing you for the EMDR. I had another therapist for more cognitive based that I had been seeing before I met Amy. She came right to my house. And I know this isn't always the case and this doesn't always happen, but I couldn't leave the house. So we started right away with therapy and how to compartmentalize what had just happened. I mean, I feel like even though it was 2 weeks out, I was somewhat in shock. I still couldn't believe that this happened. And when that wasn't working, when the nightmares, the drowning, the everywhere I'd go, hearing a siren, hitting the deck of my car, certain things were setting me off, and I would smell alcohol. We discussed, we went through that whole exercise. So it became almost hard to live with all of these triggers. We did what was called EMDR therapy. So maybe we can talk about what that particular type of therapy looks like.
And EMDR, it stands for eye movement desensitization and reprocessing. And it's a technique that was started back in the 90s, but it's been really effective in helping people process through a traumatic event. And it has you focus on the beginning of the event and work you all the way through it, unplugging the things that have gotten stuck in your mind that are causing things to get triggered. And it also helps you rework the negative beliefs you have about yourself, which could be, I'm not going to survive, or I'm not, healthy, and all of these things that also get triggered along with the more tangible things. But it's a fantastic technique just to help you in a quicker way to work through and process a traumatic event instead of the normal cognitive behavioral talk type of therapy. This is just a more interactive type of way to quickly help you get some relief.
And I think if I remember the way you explained it to me, because I think it's so fascinating. So your brain's like a big computer.
Yes.
And it takes in information all day. So you can be behind a car accident and it's going to say, okay, it's a car accident. But if there's something different about this, let's say someone was really hurt, it's going to process that change differently.
Right.
And so at the end of the day, when you sleep and you're in REM stage and your eyes are going back and forth, that's when the download happens.
Right.
I can't believe I remember all this because I
did
remember
good.
it. Thank you.
Right.
So the download happens and it puts these files in the places it's supposed to go.
Right. That's how you build your memory, and it sorts through all the information you took in that day through all 5 of your senses and files it into your memory banks, and then puts you into a deep REM sleep for another 5 hours if you're making an 8-hour sleep cycle. But a traumatic event that enters in that day, your brain a lot of times, because shock set in, doesn't know what to do with it yet. So it sets it aside. And sometimes setting it aside, it gets stuck and embedded in your brain so that you don't process it properly. So this technique helps you do that at an awake state. What happens when you're normally sleeping, you're completely awake. And I would encourage anybody to go ahead and Google that.
It's pretty cool.
Yeah,
I mean,
it's
the way I did it, I held paddles that vibrated one at a time with my eyes closed, thinking about the event. And what happens is anybody, if you close your eyes and someone taps you on the shoulder, your eye moves to the side, and then it taps here.
That's right.
So it forces your eyes to move like REM sleep.
Go back and forth.
Right. So while you're awake, all of a sudden you are in a safe place processing the same event in your mind. And you might think that one part of it really upsets you when you talk about it, but next thing you know, when you're in this element, in this state, you remember something else that really upsets you a lot more that you never even thought upset you. But now it gets to be downloaded in its right bucket, not with fear, not with anxiety, with an acceptance. It's like, okay, so yes, I was taken in an ambulance and I was transported quickly and I could have died. Okay, it was an ambulance. It saved my life. It's not as scary now when you hear an ambulance. I'm telling you, it works. And I thought it was hokey pokey, and it works.
And some of you may feel like in the beginning, oh, I'm fine. You know, I realize this happened and I'm fine, because there is such a thing called delayed trauma response. So you may not be hit with these effects of the trauma for a week, 2 weeks, a month from now, that sort of thing. So it's not necessarily something that happens or you're experiencing right at the moment or the day after or whatever. There can be a delayed. So it's something that you need to just be aware of in a course of time. And, you know, it might be something that your family members may pick up on first and then bring to your attention.
And it is interesting because our doctors can help us heal the body.
Yes.
And we're taking medications, but your brain is its own organism and it is going to take a hit. Now, even if you have an aneurysm, this waiting period that for those of you who are in, including myself at this point, waiting till it hits that magic number or you have a combination of symptoms is horrible. It's the place you want to be because you don't want a dissection. You want people watching you, but it is it's so much anxiety in here comes my next scan. What's it going to say? Or I have a pain. What does it mean?
Causes obsessing on that.
If we can't do EMDR because we haven't had this not a traumatic experience, though all of this is traumatic, what are some ways we can ground ourselves, which is legitimately a very easy way, I think, of relaxing the body, which is important for blood pressure, stress, and everything. What are some techniques people can do for grounding?
Well, and we could also incorporate EMDR in that, because if you're sitting around waiting for that number, that may be a long time down the road if it ever happens. That is a form of traumatizing yourself with this information. And so we could use EMDR to just help reinforce some more positive ways of thinking, positive beliefs. So that's another way to cope. Other grounding strategies, though, is just, you know, living in the here and now. What can I do now? What's in my control right now? What do I need to get done today? And staying focused on just the present things. Because if you're anticipating the what ifs or when, or you're preoccupied with that a lot of things in your day-to-day may get neglected. Take care of yourself right now. Shower every day. Get dressed. Eat well. All of those things to take care of yourself, your body, and reinforcing, you know, I'm in the care of my doctors. They're monitoring that. So I have to trust them. I'm going to let them handle it. Those sort of things.
And what ifs are very destructive.
Terrible.
They're horrible. It gets you locked down. It's bad.
Makes a mountain out of a molehill, the what ifs.
They do.
So
they do.
Stay away from those phrases, the should haves, the what ifs, I have tos, those kinds of things.
Now, a lot of people will end up feeling guilt, feeling a deep sense of guilt, even though we didn't have any control over this situation, where we feel guilty because we're now this new version that we don't like. We don't see the old version. Our spouses might have to really help us a lot. We can't even do simple tasks around the house. So what good are we? And maybe we were better off dying. How do you combat some of these thoughts? And I'm sure they're normal. So what can we do?
Well, first off, you're just assuming that people are thinking this way. Maybe this might be the way you think if somebody you love was in the same situation. So, but we don't know, and we can't assume what the other person is thinking. And when you're in a relationship or you have family and all, we're in it for the long haul with you because we love each other and we're caring for one another. But it's important to have an open line of communication with your caregivers. Let them have an opportunity to express that to you, or get them involved in a caregiver support network, but so that you're not feeling like they don't have an outlet to express themselves. But I really think at this point it's so vital to talk with one another about your feelings, and sometimes just the acknowledgement of, yeah, this really stinks, this is really difficult, or whatever. Even though there's not a whole lot you can do to change that, it just helps to acknowledge that between you, especially like husbands, wives, boyfriends, girlfriends, your parents, whoever is your caregiver. I think you just have to have that open line of discussing it.
Well, I'm just going to check real quick because I haven't been looking, but I'm going to see if we have any questions. Just one second. Let's just see. Okay. Oh, there's my girl Lisa. My transport nurse is on here. She's like my lifeline. One of my really important people in my life. Yes, we are lifelong friends. Yes, friends
right
since
there,
our
right.
ambulance ride. Boy, she held together. It's amazing. I love you too. All right, I'm still scrolling down here. Let us see.
And what's important, if I could just add too, I know that there is a lot of like teaching and training that goes on with healthcare professionals, but anyone who comes in contact with a patient, whether it is in the ambulance or from the minute they walk into the hospital, and it's a nurse, an aide, a doctor, to be aware that this event could be traumatizing to this person, and just trying to be more aware of what you say or what you do, because I think it gets to we have to save someone's life, and that's the focus. But there can be some ways that you can address some future things just by being more calm with your words, or those types of things. So
I'll tell you, when I was in the ambulance, she was so calm. She would have let me do anything I wanted to do. But you did bring up a good point, because I think that for a lot of us too, now going just to a regular doctor's appointment, follow-up, a CAT scan can be so triggering for some people,
right.
Or just nerve-wracking, and having a blood draw, or just having your physical, just having anything where people are touching us can be, can make you pretty anxious. And so I think what I've done now is I just go in and I just tell everybody, hey, I'm a little crazy, and I have PTSD, and I can take open heart surgery, but just be gentle when you take my blood. And they,
Yes.
I'm already lost.
We've worked a lot on Karen advocating for herself, so it's important that you do that. Yeah. And you cannot worry if they think you sound weird, or wow, you've been through an event that most people will not go through in their lifetime. So you're unique in that, and you need to be your own voice. Yeah. And if you have a certain arm or a certain way you want blood drawn, speak up. You know what's comfortable for you. You know what works for you. And everybody has their own style on how they do it. I know for Karen, it was the alcohol too, the smell of those swabs, and just trying to work through each thing. They may want to come in, get it done, and get out of the room, but she needed a little more time with that process. Yeah. So what might be, not even a 5-minute thing to draw blood, she might have needed 10 minutes just to work through each of those things. But it has to be you, unfortunately, almost educating these medical staff, or just advocating for yourself.
I just had a dentist appointment, and I who likes the dentist, honestly, but I went to the dentist just to have a crown, and I knew we'd be numb. I knew it wasn't going to hurt, but it's the first time I'd ever took nitrous oxide, because I literally couldn't sit there and see them with masks and smell the. I was so stressed out about. I wanted to just jump off the chair, and they were, anything you need, to make you comfortable. I got a nice
That's
pillow. I had a
good.
nice blanket. They
'Cause
put on spa music.
those are things you don't even think of
Didn't
that
think
could
of.
come up. Yeah.
And it just happened at the dentist. And it is important for you to advocate for yourself, just like it's important for you to talk about what you're feeling when you have to go to the ER. There's never any shame in going to the ER. There's nothing wrong with finding out that everything's all right.
Yeah.
So, and you've pretty much bought your ticket in. I don't think there's really many ERs that have a dissection patient or somebody with a hovering aneurysm just to sit out in the waiting room
Right.
at this point. So yeah, definitely advocate for yourself.
Gotcha.
So Kevin says he's terrified at night, every night, dissected at night, can't stand night. Blood pressure rises, anxiety is bad after the sun goes down. He's all better after sunrise, but really can't stand nighttime.
Wow. And I can see how that got connected with you. You're associating the evening hours in a negative way with your dissection. And you'd probably be a good candidate for the EMDR just to separate those two from each other so that you don't see nighttime as a negative for you. But on the short term, I'm wondering, do you sleep with lights on or have like the television you fall asleep to or music or anything that can kind of break up how things were of that night that happened?
Well, Kevin, when you get a chance, write us back if you're still there and let us know if you do that, if you do sleep with any of those lights on. Jamie. Greg, yes, Greg talks about, he knows the smell and the alcohol.
Mm-hmm.
I'm not too sure if you were meaning that affected you too. I can't remember, but yeah. And my son was cleaning the kitchen table. I think I told you this not too long ago, and he really used a lot of Windex.
Oh,
and
right.
Was just going to sit down in the family room, and it stopped me dead in my tracks. I literally didn't see, all I saw was a wall of white. I could hear the IV machine beeping. I could hear something beeping, and I could smell the alcohol. And it is the strangest thing when you literally think you think you're hallucinating. You see something that you know in your mind isn't there,
right.
And you're smelling things, and you start hearing things, and you can start tasting. And I stopped, and I just said, "Where's the alcohol? Who's the alcohol?" And he said, "I'm using Windex." And I said, "That was the last time I could have the Windex." We had to go out and buy a Lysol lemon because I can't stand. I won't clean with the Windex now. It's just too. It's really it's killing me.
It's interesting because I mean, time does heal, but I think for patients with dissection, it takes a little longer because this is a life event that changed your health, and it's something now you have to live with the rest of your life. But I think the triggers can get better, but it's also a reminder because Karen has been getting some treatment ever since she had her dissection surgery, but still here and there things will pop up again, like this Windex, because for her, she has done a lot of work, has worked through a lot of different pieces of this, but there still may be a year down the road something sparks something else. That doesn't mean that you never got through this, or look, I'm still not work. It just means that
you need a tune-up.
Yeah, and go in and I would recommend anyone who's been through major surgery like this to seek out a mental health provider just to help sort through it, talk it through, and look at these effects that it's had on you. It's all normal to have these type of things in your mind and all, given what you've gone through. But I think sometimes it's difficult to try to work through it all by yourself.
Now, let's talk about caregivers a little bit, because there may be some out there that are watching or will watch. The caregivers, I am sure, go through a myriad of emotions, everything from their own fear and anxiety. It's traumatic for them too, so they probably get triggered themselves.
Secondary traumatization like that.
And then there's got to be an element of some resentment, I would think would be natural and normal, just because life has now changed and it isn't what they thought, and then they might feel guilty that they feel that way. So I can only imagine what a caregiver goes through. What are some things you can recommend?
And I definitely recommend either getting involved in a caregiver support group or maybe counseling for themselves. That's when you got to open up that line of communication between the two of you. But there is, because their lives are forever changed now as well. they also worry about you. They also think, about that day. They also thought about, what it might be like if they had lost you that day. So the whole life death thing affects them as well. So I think they have to get some support from for themselves. And there are, I know even here in Maryland, there are quite a few caregiver support groups going on. So I definitely would recommend something like that. Groups many times are good because you can hear what other people are going through. You don't feel so alone in this, and you can gain ideas from one another.
So Kevin wrote back.
Oh, good.
And he said his brother also died of an aneurysm rupture in his sleep in the night. So that's another reason. So no, he doesn't sleep with the lights on or the TV on. He just hates night, just frightened of the sun going down. And this is, I believe Kevin is into 7 years, I think.
Wow.
So that's a long time, and that's got to be very difficult to have to live like that. So what are some things he could do on the immediate, other than, of course, go to see a therapist? What are some things you might be able to do?
Because I really feel like that's what's happened, is the trauma piece is connected time and day with this, and trying to get some help to separate that out, because I'm concerned that you're not getting adequate enough sleep too. Or if there's a way you sleep during the day and you're up more at night, or just trying to change around some things like that to adjust to that. And is it just when you go to sleep, or is it just you start feeling anxious as soon as the sun starts going down? That's what it sounds like for me. You're already making the connection of nighttime is a negative thing. And so let me encourage you to, if you haven't, seek out some trauma treatment for that. And
now, not every therapist does EMDR.
No, not everyone does.
Training.
So there is a website, EMDRIA website, that you can go on that does list EMDR practitioners. But you can also, when you call a counseling facility, ask, do you have someone there that does that specific technique?
And Kevin, I promise you, it works.
It works.
There's a lot of people in our community have tried it, and I promise you, it works.
And I had to have it done on myself on a very low scale, just for my training, and just from that, it works.
Jamie, who is one of the co-founders of Aortic Hope, me. She's a caregiver, and EMDR is working on her. So see, Kevin, there's proof right there. It's already working on her.
Great.
So Christina says, I always feel scared that something else is about to happen. I was unconscious when my daughter found me, and then they rushed her to the hospital after the CAT scan. She was rushed into surgery. Her anxiety keeps bringing her down, and it's been a little over a year since her dissection.
Okay, so you're fairly new with that still. Okay. And I would also, my question would be, how is your daughter also coping with this? And she's the one that found you. But is that more of the issue, just your concern about it happening again to her, and her having to experience it? Because if you were asleep or unconscious, you may have missed all of those signs that were happening prior to that. So there again, it'd be interesting. I'm sure you and your daughter probably talked about this, or I hope you have. I would encourage you to try to hear each other out, what that meant for her, what that meant for you, and just try to work through that. The first year with everything, I think, is the hardest year, because you are anticipating something else could happen, and it's that fear of the unknown or the unexpected that comes upon you. But I think as time goes on, and you'll get a little bit more at ease with that. But the first year, just all the
what ifs. It's a what
ifs, and the follow-ups with going to every doctor again and again, learning. And all of that. It's just it's an overload, I think.
Well,
all of that.
It's a year of having thrown in your face the severity of what could have been.
Right.
And that's a tough year. Year one is hard. And statistics wise, if you read stuff on the internet, it's like you just want to get to the next year and the next year. And the only thing I can tell you too is it gets easier. Everybody told me it gets easier, and I didn't believe anybody, but that's what we're all here for you in this world.
This is a fantastic support network with the aortic hope.
Promise
I think
you.
It's awesome.
Thank you. And it does. It gets easier. I was right where you were, talking to people in the middle of the night. I mean, scared to death. First year came around. That first aortiversary was just so scary. And then it just became the next day. And nothing happened. I don't know what I thought was going to happen, but it was bittersweet. But it gets easier with each year. I promise. It really does.
Yeah.
So Greg says that he has some brutal nightmares. However, he has little to no memory of his entire initial event.
Oh, okay.
He was conscious, but not really there and all with it. So he's not sure what really is real that happened to him and what isn't really real. Does he just let those thoughts go, or does he try to get to the bottom of them? Just, I think a lot of us are like, what, I know for me, I'll think, where was I in that ambulance, and what did I say? And it's like you just have this hole and you need it filled, like it's a driving force. And so is it better to keep working to figure out what happened, or just let it go? It's happened.
Well, if nightmares are that brutal for you, I think nightmares like that are really trying to tell you something. That's your unconscious mind trying to work through. That a lot of times nightmares are just magnified dreams that, and in like another is to simplify it. Like we simplify our sleep cycle into 4 stages. Stage 3 that's the stage right before your REM sleep. And that's the stage where your brain is still trying to work out real life things that happened. And so that's where those nightmares may be coming from. And I think it is worth taking a look at, because it is really disturbing, it sounds like, for you, disturbing your sleep, but also just your overall well-being of how you feel about yourself. And so in therapy, they may have you try to keep a dream log and see if there's some continuing themes with these, or you could even use, I have done EMDR with individuals who've had severe nightmares, and we've just picked a part of a nightmare that they can remember, and then we process that, and it's amazing what can come up from that it's your unconscious mind trying to still work through it.
So do you try to figure out the holes in your memory, or is it just better off to leave it, because it can be nagging?
I think in a way, your dreams, your nightmares are telling you need to try to still figure out some things.
So through EMDR, I know it's not hypnotherapy,
right?
And I know the answer for me, but do people start remembering other points and bits and pieces? Because I know I did.
They can start.
Yeah. There were things I never knew.
Because sometimes with trauma, it's so horrific at the moment it's happening that your brain, when it uses shock, it kind of like suppresses and all the memory away, just so you can cope with what's happening at the moment. So for some people, it takes a little longer. It's a slower process for some of those memories to come back. But there's a good possibility that you'll start getting some bits and pieces. Now, for the young woman who was unconscious when that happened, she may not get the full effect of that. I'm not sure, Greg, what your situation was, why there isn't memory of the initial event, or if you were unconscious or what was going on there. But I understand you were saying you were conscious, but not there. So I'm trying to figure out, is that because
like just kind of sort of out of it mentally?
Yeah, was the trauma already setting in, and so it was blocking you already from that kind of thing?
Yeah.
But the fact that you can say that you were conscious, I feel like more of a chance that other things are going to come through in time. So
try EMDR, Greg. Let's see. Oh, Christina, you're very welcome. and there's another caregiver. Husband does not remember about 5 weeks after his dissection. Just it's gone.
Yeah.
And more is going to go because that's
Yeah.
called pump head. That's a whole other phenomenon of just things go in and
Blocking that, that's it. That's normal.
Yeah.
So a lot of these, you can see sleep is such a huge thing that gets affected when a trauma has occurred. So.
Yep, trauma sent you on a vacation, huh, Greg? I think it sent us all a little bit on a vacation.
Not one that you
not one that I would have picked. But
right.
If anybody has any other questions, start sending them our way. I don't think we're going to go to the full 9:30 just because it's late. But as you know, if you're just joining us, we are here talking about trauma, talking about guilt, talking about all of our emotions and just the ways that we can treat ourselves better emotionally and fix our brains because they don't get enough time and attention after we're dealing with aortic disease.
Right.
So any other suggestions you might have for ways to help your brain?
One other thing I wanted to note was, all of you was fine one day and then the next day you were thrust into this new way of living, life completely different. So you have to take some time to try to catch your breath, so to speak, with that. Many of you weren't able to return to work, have had to go on disability. So with all the changes that brings. So that's why I want to encourage you, if you're not in counseling or getting any mental health treatment, just for the sake of trying to deal with the multiple adjustments you're having to make in your life, I think is a benefit of going.
You just brought up a good point. For those of us that are trying to get, or for those of you that are trying to get your disability, especially if there's any record of PTSD as being a contributor to you not being able to work, they will send you for a psychological evaluation. Can you explain a little bit what happened during that fun test? Do you know what happens during that fun test?
What does?
The evaluation that they do before disability?
I've done a lot of evaluations, but a lot of times, the frustrating part is they want you to go to their appointed doctors. So even though I may fill out the paperwork, send in my information and all that, sometimes you feel like you may be getting the runaround because the state makes you go to their psychologist, their doctors, those sort of things. So it can feel like it's a forever process, but it can feel more invasive too, because they are going all the way back to childhood. They're all asking you all kinds of personal questions because they're trying to determine how much of this was going on prior to your incident, the event, and how much is now because of. And so that's how they want to determine if you already had PTSD prior to and this added to it, that's one thing. If this is a new thing, so all of it depends on the type of level they're going to award you and different things like that. Some people don't get it the first time around. Sometimes it's necessary to seek out a lawyer that this is what they're a disability lawyer, because it's going to require all your doctors sending in paperwork, because you're going to get a disability on medical and mental health. So
they are two totally different
two
things.
separate things, and they need all that documentation from all of that. So for those of you that have already been through that, you understand what it means. For those of you that have not started that process, that's another reason to start looking into therapy for yourselves to get some documentation if that's the route you're going to go for disability.
I can tell you I passed, even, well, we know that, but I remember when I went for my appointment with their doctor, and perfect timing as I'm answering questions, an ambulance went by with lights and sirens, and I mean, I felt so embarrassed because I totally lost it in her office, but in a way that was exactly what she needed to see. But it was it's very strange. Just write your name on a line, crinkle up the piece of paper, throw it down and pick it up. It's how well you follow questions. Are you able to write your name? Are you struggling with memorizing shapes. Can you look at a shape and draw the shape? It's a very interesting,
Yeah,
bizarre, almost cognitive type of a test, and there's no empathy, there's no conversation. They don't want to know anything about you. You have to remember, this is not a therapist providing therapy.
Right.
This is somebody that's performing a test and
right, an evaluator,
and they're just an evaluating.
and a lot of times it's just questions. They got a list of questions and they're just going down the list. And but I think all of you would qualify for sure on the medical and the psychological effects that have been left there. So,
and Michelle, if you've already been declared disabled by the state, they should just be awarding you your SSI or SSDI, depending on what you've been awarded. They would be the ones to determine if they need you to see a doctor, and that would be in the process before you've been determined to be disabled. And what we discovered with our interview that you can look back on our files with the attorneys is, number one, you should definitely have an attorney, but number two, they usually do not recommend you accepting that appointment. They will try to fight for you to not see the state doctor. So don't go see it. If let your attorney know and let them, this is what they do, let them tell you. But to answer your question, you would really want to ask an attorney. It sounds like you've already been determined to be disabled, and so then it's just a matter of, it's another waiting game before you get a letter and you get your award.
Right, that's what it sounds like.
You might want to talk
You've
to an
already
attorney.
been approved.
Yeah, yep. Yeah, Michelle, always go to their doctors. You're not going to, you just go to your own, you would just go to your own physicians. So
because their doctors are paid by the state. So where they say they're fair and impartial, I think it's important to have other outside documentation as well sent in for your case.
Yeah, which makes sense why you should be seeing a therapist. All right, does anybody else have any other questions? This is the time to send it in. I think we are going to probably start to wrap this up because I'm getting tired. It's 10 after 9. But this has been great. And actually tomorrow we're going to put up actual techniques, and which you can talk to this if you want, of ways to ground each of your senses.
Yes.
Everything from what's this called when you tighten up, and then releasing and doing it from the top of your head to your toes. So that would be more physical.
All kinds of things like that.
Touching your skin, tapping.
And I'll give you those. You can post, like if you're feeling very overwhelmed, almost having a panic attack, anything like that. 5, like using your hand, 5 things you can see, 4 things you can touch, 3 things you can smell, and going down like that. Just to try to help refocus yourself, because when you're anxious, your mind is going in a million different directions.
Wait, let's go through that one more time.
Okay.
So when you're feeling really anxious, so 5 that you want to stop and try to find 5 things to look at.
Yeah. 5 things you can see.
You look at them.
Right.
Okay.
4 things you can hear.
So you're just trying to focus on different sounds.
Do I hear a bird or a song or whatever? 3 things that you can smell.
Okay, so you just start to focus on something, divert your attention.
Right. 2 things that you can taste.
So you just do that in your mouth.
Right.
Okay.
And the last is touch. And a lot of times, I don't know if I can get my arm up here. I have clients like this is like pressure points here in your wrist. Just lightly press on those pressure points. Hold it, and that's your touch. But it also helps with just refocusing and a feeling and that sort of thing. There is a whole line of books out about pressure points and things like that. There's emotional freedom technique that you can learn too, with kind of tapping and everything. But it's holding those pressure points just to try to help calm you down just a little more and help you stay focused.
Those work too. I'm telling you, those work. And we had talked about that because, and I couldn't remember the 5, 4, 3, 2, 1, but sometimes when I do, if I see an ambulance coming up behind me with lights, I'm just going to die. If they hit their horn, I know it's just going to be bad. So I immediately, I like to touch above my eyebrow. And then I will try to smell my air freshener. And then I might start grinding my teeth if there's nothing in my mouth, and then I'm going to pay attention. And sometimes now I'm deliberately listening to the siren. I force myself to just soak it in. But doing all of this, it just divert your attention.
Right,
You're
right.
like touching, I'm doing, and by the time you're done saying what you're doing, the ambulance has already gone by. It's already gone, and you've survived the moment. And this really, if I get irritable, I'm surprised I have an eyebrow at this point, but if I get irritable in my home or with anything in my life, you could just see me doing this. Actually, it's on the other side. And it's just to self-soothe, and it's a distractor. Right.
Self-soothe there and be distractors.
Kevin, you're very welcome. Michelle, would SSA know that my state declared me disabled? No, they know. The state, if you've had a hearing or they should be working together. You can always make a phone call to double check, but it sounds like you've already done the paperwork and they've declared you to be disabled. Now they contact your local office and everything's done behind the scenes, but they are so short-staffed that it could take 6 months easy before they get the hearing decision, and then they start to implement, but it will be retroactive.
Yeah, the back pay, all of that.
So yeah, your back pay will go back, your benefits go retroactive, and it is such a pain to do retroactive, but it's good because you'll get the retroactive.
So, so Michelle, if you've already gone to your local Social Security office, completed that application, all the documentation's been sent in, then you should have got a reward letter or a decision letter about that, or when it would start, when you would start receiving your checks each month, that sort of thing. If you haven't even gone and done the application, I'm not sure who declared, the doctor declared you disabled, or you actually went to the Social Security office and handled that already.
I mean, I think it's been 7 months for Michelle, if I'm not mistaken, from a conversation today. So I'm not sure, everybody's situation is different. Sometimes if someone's had really bad strokes, it's like an immediate decision pretty much, but you still need to fill out paperwork. And I don't think an employer does that. So you may want to really double check as to where you are in the status. I am not going to give you any advice on that because I'm not an attorney, but you can actually call an attorney, and if you send us a message tomorrow, or actually Greg or Tia can look up the information for the attorney that we've had on our website. It's Dougherty, Cella, and Keene. I'm not going to spell it right now, but it's on our website. Their information's on there. They'd be more than happy to look it up for you and just research based on your Social Security and give you an idea on where you are actually literally in the process. So contact one of them or myself tomorrow, and we'll take care of that for you.
Great.
So, all right, guys, it is going on 9:15. I think we are going to call it a night.
Okay.
If you have any other further questions, or as you guys are reading this, please don't hesitate to post the questions. Amy has access as part of Aortic Hope. She's part of the group, to take a look at your questions, and she'll check in a couple days and just see and give you some answers, starting at Michelle's question right here. So, and if you miss this, well, you'll be watching it right now by video. So there you go. That's with that. Right. Thank you guys so much. Tomorrow is Ask a Doctor, starting at 6:30. And it's not a live event, but Dr. Prakash will be sitting at his computer watching your questions pop up, and he will be answering them for you in real time. So Amy, thank you again so much.
Thank you
as
for
always.
Having me. I enjoy it.
It's always so good. And hopefully we'll see you in one of our support groups soon too. All right, guys, have a great night.
Take care,
and
everybody. Thank you.
We'll talk to you soon. Bye-bye.